Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Health Care. We're talking about congenital heart defects, a condition that impacts many children.
Congenital heart defect is a problem with the structure of the heart, and it develops as the heart is developing during fetal and embryonic life. So when that process doesn't happen normally, a child can be born with a congenital heart problem, a structural problem of the heart. We don't understand a lot about why congenital heart defects happen. We know that there are some genetic factors. For example, when there's a strong family history of congenital heart problems, it's a little bit more common to have a congenital heart problem in that child. And we also know that there are some nutritional aspects. For example, moms who take prenatal vitamins have a slightly lower chance of having a baby with a congenital heart defect as compared to women who do not take prenatal vitamins. So there's a couple factors, but we don't understand a lot of the specifics.
Is all heart disease in children considered congenital?
The majority of heart problems in kids is congenital. It's a structural problem that the child was born with. But there are several other what we would call acquired conditions. So things like infectious problems that affect the outside of the heart, we call that pericarditis. Infections that affect the heart muscle itself, myocarditis. There's also blood vessel problems like Kawasaki disease that can have effects on the heart. And also there's several types of arrhythmia that happen in children as well. So those are electrical disturbances of the heart that are important.
How common is congenital heart disease?
Congenital heart disease, if you look at most studies, they'll report an incidence of about 8 per 1,000 live births, or 0.8%. That actually doesn't include the most common congenital heart problem, which is a bicuspid aortic valve, which is present in about 1 in 50 individuals, about 2% of the general population. That particular congenital heart problem doesn't usually cause problems or symptoms until way down the line, 5th, 6th decade of life. So a lot of times it's not counted in the tally of congenital heart disease.
What is the difference between a heart murmur and structural heart disease?
A heart murmur is an extra sound that blood makes as it flows through the heart. The majority of murmurs are what we call innocent murmurs, which is to say, sure, the blood makes a sound as it flows through the heart, but it's not the result of any structural heart problem. Innocent murmurs are incredibly common, so more than 50% of children will have a heart murmur at some point or other during their childhood, and the majority of those are innocent murmurs. Less commonly, you might have a structural problem with the heart, for example, a hole between the different chambers or a valve that's not working properly. That can also cause abnormal blood flow that we call a murmur. But there's a difference between innocent murmurs, which are very common, and structural heart problems, which sometimes create murmurs.
Who is at risk of having a child with a congenital heart defect?
We do know that moms who take prenatal vitamins have a slightly lower risk of having a child with a congenital heart problem as opposed to those who do not take prenatal vitamins. And there's also certain medications that, that should be avoided during pregnancy or in moms who are trying to get pregnant. And whenever there are questions that come up about that, I always encourage women to get in touch with their obstetrician so that they can offer some advice as to what medicines are safe to take during pregnancy. As a first-degree family member of the baby who has a congenital heart problem, it raises the risk from about 0.8% to somewhere in the neighborhood of 2 to 3%. So not very high, but certainly higher than the background rate of congenital heart disease in the general population.
What are the symptoms of congenital heart disease?
The symptoms depend on how severe the problem is. So the majority of subtle structural heart problems actually might not cause any symptoms at all. The more significant ones oftentimes can cause extra blood to flow through the lungs, and then that extra blood needs to be recirculated through the heart. So it's a little extra work for the heart. To keep up with that demand, babies tend to pump up a lot of adrenaline to try to help their heart through that. And the side effect of having all that adrenaline floating around is a lot of sweating, particularly during feeding, sometimes some peripheral color changes like blueness or paleness around the lips or mouth, and also labored breathing from the extra blood going out to the lungs. Most of those symptoms happen in infants during feeding because that's like exercise. It's like a treadmill test for a baby. So a lot of times the symptoms will come out during feeding. More severe types of heart problems can result in more severe symptoms. In an extreme case, you can have cyanotic congenital heart disease where blue blood without oxygen gets recirculated through the body, and that can cause a profound blue discoloration of the baby that's not subtle and is very dangerous.
Is congenital heart disease treatable?
Most congenital heart disease is treatable. The most common types of congenital heart problems, for example, small holes between the upper and lower chambers of the heart, oftentimes actually will repair themselves without us doing anything. More severe types of, or more complicated types of congenital heart problems sometimes require surgeries, sometimes require catheterization. Catheterization is where a specialized doctor uses long, flexible plastic tubes to insert them into the large blood vessels of the heart. Large blood vessels of the body. They're advanced up into the heart, and then special catheters can be used, for example, to stretch out valves that are narrow. The catheters can be used to deploy devices to close holes in the heart and that sort of thing. So there's many treatment options, very much catered to the specific problem present in the child.
What are the treatment options?
Some congenital heart diseases are what we call curable. That is, a surgical, they might cure themselves. A surgery or catheterization might cure the problem without any need for further intervention. Many of the most complicated types of congenital heart problems are not exactly treatable. We have catheterizations and surgeries that can make the circulation better. It can make the heart function more appropriately. But a lot of those patients will require lifetime follow-up to treat residual issues that are left over by the surgery or the catheterization.